If we diagnose a skin cancer, treatment options will depend on, firstly, who the patient is, what I believe the type of cancer it is, and where the cancer is. Most often than not, with certain skin cancers, we will lead to an excision, which means that we have to cut out the whole lesion, either with a scalpel and putting sutures in, or by doing a shave and a curette. There are other types of cancers that we have other options to treat with, including sometimes rarely using like a liquid nitrogen spray, certain types of creams. There are some other more complicated cancers that sometimes will need a bit more advanced treatment. Sometimes we have to do some more referrals, might be to a plastic surgeon or for radiation therapy. But we'll always guide you through all the different options and figure out what's the best option for you, give you the best outcome. So sometimes on other areas that aren't as cosmetically sensitive, we can use often more lead towards a curette and cautery if it's a small lesion. So that means that if it's a low risk skin cancer, we can do a little bit of a scoop of the cancer out and then do a bit of a char at the base. This gives very similar cure rates to an excision. The scar does heal up quite well most of the time, but it does leave a big white circle where sometimes something on the face would lead more towards an excision where we have a nice thin line. It would depend on the type of removal that we've done. In general, sutures are in our clinic for 7 days. Wound care is often a dressing on for 3 days, and then we give you specific instructions on how to manage the wound afterwards. Usually on how to clean the wound, how to deal with the dressings, whether or not we recommend often putting some Vaseline or even better some silicone gel to improve the scar. And it depends on what the patient would like to do and how much of the cosmetic outcome matters to them as well. Someone who's detected with a high risk skin cancer, there are guidelines that will vary between 4 monthly checks for the first short period or 6 monthly checks. Sometimes if it's a melanoma, we will also do a check of the lymph nodes, so feeling around your neck, armpits, etc. For other patients that are a bit lower risk, it might still just be 1 year. It varies between how much skin cancer we have. We have some patients who are coming every 3 months because they've had quite a high skin cancer burden, and some of our patients who've just had their first small cancer and we can still continue with 12 monthly checks.